This is episode 30 of the BioBalance Health Podcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And this morning we're talking about insomnia. But we're not talking about all kinds of insomnias. We're just talking about a specific issue with insomnia and an approach to insomnia. If you go back and look at podcast 29, one of the things that we talked about in that podcast was you have to be careful about globalizations. And so today we want to really focus on not being global with a global word, because everybody has an impression of what insomnia means. So Kathy, can you talk specifically about the angle of approach you want to use when you talk about insomnia and why it's relevant to what you do at BioBalance Health?
First, there's some people who have insomnia their whole lives. We're not talking about that. We're talking about insomnia that occurs after the age of 35 to 38.
Okay.
In that area, it's part of what everyone states is part of aging. But it's really based on the loss of a hormone. And that hormone is testosterone. It happens earlier in women than men. Usually men, it's in their 50s, and for us, it's in our 40s. But this type of insomnia is the type that creeps up on you. You don't notice until you have had it days in and day out that you don't have any energy during the day. And the other thing is you wake up unrefreshed. That's my key symptom, is not do you have insomnia, do you wake up with hot flashes, but do you wake up unrefreshed? Because it's not the hot flashes that do that. That's a lack of estrogen. It's not getting into a certain stage of sleep that actually heals you. And insomnia over a long term can be very bad for your health, but also for your life. It decreases so many things like balance and being able to drive and being sleepy while you're trying to drive home at night and that kind of thing. So it's very important.
From that also causes irritability and crankiness, and that feeds into the reputation about going through menopause, that all of these changes make you be somebody that you haven't been and make you be somebody that's difficult to be with.
But they don't address the issue that this happens 10 years before menopause.
Yeah.
This is early on, so we don't know what's coming. No one talks about it. You know,
You just get used to it.
Women's communication is one woman to another.
Okay.
That's our communication method generally, or groups of women talking about something. Well, women go to coffee and go, I've got this insomnia, oh, I've got that too, and I can't sleep, I wake up, I don't feel well, and then the fatigue issue. So they don't remember that insomnia is causing the fatigue. They go to their doctor and go, I'm tired.
Or they don't, or they don't know. Because
that's why we're talking about it.
It is stress. And they say, oh, it's your children, or it's your job, or it's trying to be superwoman and run a house and run a business and raise children and run a husband. And so, of course, you're...
Take care of a husband.
Same difference. Same difference, you know that.
But...
Yes, dear.
Yeah. Okay, so women are very stressed in their 40s. And I understand that. I've been there. And the stress is from their children and from their parents that they're taking care of. They're squeezed in, and even if they have a job, it's their job to be the caretaker.
Oh, absolutely.
So that's very stressful.
I have to think about important things like, should we let Red China in the United Nations, and what should we do about the debt load? You have to figure out about dinner, and was the laundry done and the kitchen floor mopped?
Not if you manage it right. Then your husband can make dinner.
Yeah, well.
In any case, we're tired. We're tired. That reminds me of the Saturday Night Live. Yeah, Madeline Kahn, you know, and Young Frankenstein. And in any case, we're tired. And that's coming from lack of sleep and many other areas. It's hard to sort it out, but if we check testosterone levels, those go down at exactly the same time as insomnia starts. So not feeling refreshed and being fatigued is a sign of that. We need to get past that to go back to why it happened and replace the hormone that's missing. Now, in general, doctors approach it differently. They aren't looking for back 3 steps.
Right.
They're looking at, oh, you don't sleep. Well, here's a sleeping pill.
Here's a medicine for sleeping, or for anti-depression or anti-anxiety, and that'll all calm it down and you'll be able to sleep better.
Well, it doesn't make this kind of insomnia go away, because you may sleep, but when you wake up, you're still not rested. So that's how you know. Even if you've tried...
You're drugged.
Yeah, Ambien, or tried any of the other both mainstream sleep aids.
I have clients that come in all the time and say, those things don't work for me. And I have never until today heard that part of what we need to consider is a medical evaluation to see if their hormone balance is out of whack. Because I spend time talking to them about depression and anxiety and stress in their lives and so on, and we try to make behavioral changes. Sometimes they try to use medicine as an ancillary treatment for the behavioral changes, and they still come in and say, I may be sleeping, but I'm still not rested, I'm still cranky and irritable, I still have these issues, and I don't really know what to do with that.
Sometimes we need psychological care just to get back to normal even after we start sleeping. But you have to get the physiologic, the basis, our hormonal basis has to come back to square one, where we used to always go through the 4 stages of non-REM sleep and then REM sleep, which is where you're dreaming. Non-REM is going to sleep and starting to get deeper, and then the last 2 stages of non-REM sleep is dependent on testosterone. If you look at a nursing home at 2 o'clock in the morning, everybody's walking around who's not drugged because they have no testosterone by then.
Old people wake up early.
Really
and
early.
Catnap all the
like
time.
4 o'clock.
Yeah.
But they don't have to go do something. Now, I plan on being productive till I'm 95. So I don't want to have that. I want to be who I am and not in a daze all day. And certainly I don't want to start that at 40. That cuts our lives in half. We can't be productive, and women come in and say, I don't know what's wrong with me.
Yeah.
No one will tell me. They tell me I'm crazy.
Well, people don't know. I mean, I have done therapy for 30 years, and this is new insight for me. I mean, the standard response is, maybe there's something physical going on. Let's send you to a physician and have a medical exam because we've tried this, this, and this. Or if they're taking antidepressants or anti-anxieties or sleeping medicines, they're already having a physician involved. But I don't know how widespread this information is. So for me and for my clients, this is really a new piece of information that could be very helpful.
It is so very important that people know that there is an answer to this and that it doesn't require a bunch of drugs to make you sleep that don't really make you rested. So in this realm, this information has to get out, especially to women over 40, men over 50, because it's affecting their daily life, their performance at work, and their homes. Now, in general, like, I find a lot of other things at this point. When I'm investigating...
I was just going to say that, because you do a cocktail. You do more than just...
Not exactly. It's not that fun.
Okay. But you do other hormone replacements in addition to testosterone. And what you're saying, if I'm hearing you accurately, is that the initial issue arises out of a decline in testosterone. And of course you say that consistently about age-related debility that occurs. And so you go back and you check testosterone levels with blood tests, but you also check at least 2 other hormones. What else do you check?
I check estradiol, estrone. I check FSH, which are the 2 pituitary hormones that go up as your testosterone and your estrogen drop, and they cause sleep disturbances. When they go up, that's a wake up, hot flash, anxiety attack, something like that.
Okay.
So when estrogen and testosterone are low, those go up. When I replace it, those come down. They all work together. It's like cogs in a wheel. They all work together. So I check thyroid. I check cortisol. If your cortisol is very high, then you're not going to sleep well. If it's very low, you're not going to sleep well. The good news about testosterone is it makes your cortisol come back to normal in general, unless you've been stressed forever. And then I treat with a natural combination of adrenal hormones, animal adrenal hormones. But that is a short-term answer in addition to testosterone. But I treat all the hormones to make them basically normal and young.
Okay, so off the wall, not a question we prepared for, but in looking at the book that you are writing, there's information in that book that talks about something called tinnitus. Tinnitus,
yeah.
Thank you. And what I remember seeing in that was a reference to testosterone loss. So if people wake up in their 40s with a ringing in their ear in the middle of the night, and they're very frustrated about that, they don't know what to do about that disrupts their sleep, is it possible that there's a connection? I mean, I know that that's not the only cause of that issue.
No, I usually have my patients see an ENT or a neurologist and have it all the other things ruled out.
I really think it's important to emphasize that, because that is a consistent thing that you do. You are not ever in the position of saying the only thing that you need in life is hormone replacement therapy. If you do that, it's a one-size-fits-all treatment.
No, I don't do that.
You're very
it's
careful
specific.
about other kinds of referrals for other kinds of testing and intervention by specialists in other areas.
I refer a lot to specialists because this is the last thing you do if you have a specific symptom that could be something bad. Tinnitus could be a brain tumor. Tinnitus could be a neurologic illness. So you have to go get a CAT scan. You have to be worked up by your ENT. Then, if it doesn't go away, if I replace your testosterone, it generally will stop. And that's because testosterone stimulates fluid, normal fluid, good fluid in your joints. That's why arthritis goes away. And it also stimulates the fluid that's in your inner ear. So it helps your balance, and it also helps the tinnitus to go away. Tinnitus is usually a deal where you're hearing your own blood flow, and that's kind of like an echo. With an empty inner ear, with not enough fluid in your inner ear, that causes it to be...
So if you sleep on your side and you have your head on a pillow, does that increase the likelihood of that?
No, because the fluid would go down, would go with gravity.
Okay, so it's not
it's not too much fluid.
Issue.
It's normal fluid.
Yeah.
It's just that as we dry out as we get old, and testosterone and estrogen are the two hormones that give us back all of the fluids that we need. So that's part of the fluid. So many people say, I don't have balance anymore.
Yes.
And balance has to do inner ear fluid and how the bones of your inner ear are working. And oftentimes that's why people break their hips when they get old. Their balance is off, not their bones are fragile.
So when we're talking about a specific type of insomnia that is derived from a decrease in testosterone, we are not talking about a panacea that's going to make you sleep. It's not a sleep medicine that will put you to sleep. And it's not going to magically cure stress in your life. It's not going to cure relational issues. But not having it can lead to having relational issues and stress in your life, because when you're fatigued, you're not thinking clearly, you're not remembering clearly, you're not responding as much in a cordial way, you're not as upbeat and functional during the day as you are when you have rested. And in order to be able to rest, you have to go through the 2 REM sleep cycles, but you also have to go through the deeper, the theta
non-REM,
types of sleep. And for those issues, one of the things that a patient ought to check with their doctor is their hormone balance, particularly in terms of testosterone.
That's right. That's right.
So if you have questions about this or any of the other podcasts that you have access to, please feel free to contact us. You can email us directly at podcast@biobalancehealth.com. Also, if you get a chance, you can look on my website, brettnewcomb.com, for my blog, and you can find these podcasts on there as well.
And if you'd like to know more about BioBalance Health or bioidentical hormones, visit our website, biobalancehealth.com, or call us 314-993-0963.
Thank you.